today I want to talk to you a little bit about the seriousness of COVID-19 and what it's doing to our hospitals nationwide. It's really a struggle out there, and it's not looking too good. Then after that, I'm going to talk to you a little bit about 5 natural ways that you can boost your immune system. That article is brought to you by express.co.uk. And this video is being brought to you by CBSN. Let's start the video. Oh, before we do that, don't forget to click the subscribe button and let me know if you have any personal thoughts or experiences with COVID-19 in the comments. Let me turn on closed caption. And then I'll play this on 5 as well.
The Biden administration says Americans will be able to request free rapid COVID-19 tests starting next week. The announcement comes as tens of millions of people are struggling to get a hold of those tests. The daily new case average is now more than 800,000. Hospitalizations have already topped last winter's peak. Infections among children are also increasing exponentially. Manuel Bojorquez has more from Miami.
It's so sad, man. It's so sad that, I hate to bring this up, but it was talked about. It was, way before it actually happened. It was talked about. We all know it was talked about. And just the fact that we still have nothing to show for it, it's so sad. Nobody could have guessed this, right? Nobody could have guessed that the world would have been in this much, turmoil because of lack of information. There's tons of information out there. Lack of, the government wanting to work with the citizens of the nation. That could be it. Either way, I really feel for everybody out there. So, I guess it's better going said that, go get tested, at least. Go get tested. And then if you can, go to a local pharmacy and get your vaccine. When you have the time, I hate to put pressure on you, but, we're here now. This is where we're at right now, right? Do it. You owe it to yourself and your family to do it.
Tonight, as Omicron continues to surge nationwide, pediatric hospitalizations are soaring, more than 360%. A mix of children admitted for COVID and some who test positive after being admitted.
So it's like, even if you didn't have it when you came in, you have a higher chance of getting it because you came in. And that's just so sad. That's so sad.
Only 35% of children aged 5 to 17 are fully vaccinated. Now New Orleans is among the first districts in the...
And that's because of the parents. I'm sorry to say it, but that is solely because of the parents. You can't expect a kid to go to Walgreens or CVS.com and sign themselves up. You can't do that. A kid can't do that. The parent is going to have to do that for them. And if the parent is against getting vaccinations is against that parent's morals, then their kid's not going to get it either.
Nation to require proof of COVID vaccination for eligible students as young as 5 years old by the beginning of February, though parents can opt their children out. In the last week, more than 12 students as young as... Now New Orleans is among the first districts in the nation to require proof of COVID vaccination for eligible students as young as 5 years old by the beginning of February, though parents can opt their children out. In the last week, more than 1,600 students have tested positive for COVID.
Based on the number that we're seeing right now...
Goodness, 1,600. New Orleans is going in the right direction, though, I feel like. By having people even as young as 5, I feel like that just why not you protect your kids? You should. There's nothing radical about that. That's a completely sane observation and decision to make, especially for a schooling system.
Also hearing that the majority of our individuals who are being hospitalized right now is the category of children. That's really concerning, alarming to me.
Meanwhile, the Supreme Court's decision to strike down the Biden administration's vaccinate or test mandate for large companies has now left millions with a patchwork of state and local rules.
turn this up just a little bit so you can hear it a little bit better. But oh my God.
At least one company, GE, has already suspended its policy requiring employees be vaccinated or tested. But demand for at-home rapid tests has never been higher. So this has been 24/7 now for weeks. Yes, Ron Gutman, co-CEO of the company that makes the on-go tests, showed us the round-the-clock operation at one of its manufacturing facilities.
People have seen the consequences of not knowing if they are infected or not. And I think that people are more aware of the value of being tested regularly. We want to keep schools open. We want people to go back to work. And we want them to do it safely.
My God. My God.
So you're a programmer. You're coding along, and you run into a problem. You do a Google search.
And the CDC has just updated its masking guidance, stopping short of recommending a specific mask, but saying that Americans should wear the most protective mask they can, that fits well, and should wear it consistently. In the meantime, the White House announced that U.S. households will be able to order up to 4 rapid tests online at the website covidtests.gov starting Wednesday. Jamie?
Lots of people looking for those. Manuel Bojorquez, thank you. For more, let's bring in Dr. Andre.
Okay, so this is good. Hold on. Let me do this.
And the CDC has just updated its masking guidance, stopping short of recommending a specific mask, but saying that Americans should wear the most protective mask they can, that fits well, and should wear it consistently. In the meantime, the White House announced that U.S. households will be able to order up to 4 rapid tests online at the website covidtests.gov starting Wednesday. Jamie?
covidtest.gov starting Wednesday. You can order up to 4 tests, rapid tests for yourself, up to 4 rapid tests per household. Go grab one. Go to the website. I'll even play it again.
Up to 4 rapid tests online at the website covidtests.gov starting Wednesday.
covidtest.gov starting this Wednesday, okay? Go there. I'm definitely going to go there and grab at least 4. It's going to be like a freaking sneaker drop. That's crazy.
Amy?
Lots of people looking for those. Manuel Bojorquez, thank you.
Definitely.
For more, let's bring in Dr. Andre Campbell. He's a critical care physician and a professor at the University of California at San Francisco. Doctor, thank you so much for being with us tonight. I know here in Los Angeles, you're in California, I have friends going to 4 or 5 different drugstores trying to find those rapid tests right now. What role could these rapid home tests play in the fight against this pandemic once they're readily available?
Rapid drug tests, and she works in the health.
Jamie, thank you for having me this evening. The government and local government and state and federal government for that matter has really been behind the 8 ball when it comes to these at-home tests. It should have been distributed widely, it should be widely available, but the reality is that many regular people have been struggling to get tests. You go down to one pharmacy, second or third one, it should have been readily available. So we probably should have rolled out mass testing earlier. In many ways, the government really was pushing vaccinations, which I think we still should. And you mentioned how low the vaccination rate of adults, it's 62%, and kids, it's only 35%. If we get that number up, it will do better, and we won't have as many pediatric hospitalizations as we have. We must protect our kids who are in school as best as we can.
We must protect our
I know so many people talking about that, as you just said. Just over 35% of children between the ages of 5 to 17 are fully vaccinated. I think there is some disconnect in terms of the messaging. So as a doctor, what would you have to say to parents who are choosing not to vaccinate their children at this point?
Yeah,
In my opinion, it is dangerous not to vaccinate your child. This is an incredibly communicable disease. Think about what's going on now. We have now we've been diagnosed with 800,000 cases. There's been roughly 850,000 people who have died from the vaccine, and we're diagnosed between 600,000 and 800,000 cases a day. So the country is really wildly on fire. There's 150,000 people in the hospital. That includes adults and children. So my advice to the parents are get your child vaccinated as soon as you can. They're safe.
First of all, grab yourself some Ghost Energy. Sorry, I can't get the blur right. Grab yourself some Ghost Energy. Before I was drinking the Warhead Sour Watermelon flavor. This is the Sour Punch Blue Raspberry flavor. So it's really good. Really good. Go grab yourself some. There we go. There's the focus. Whatever. You get the point.
No complications associated with it. Please do that for yourself, for your kids, and make sure they're safe when they go to school.
Yeah, I know some friends out here whose children were vaccinated and they ended up picking up Omicron, and the kids were pretty good after a day or 2. I mean, it really does make a difference. When we're talking about these vaccinations, researchers in Scotland say that
There you go. There you go. And our kids, right? The kids of this generation, they're the ones that are more than likely gonna survive this disease, right? And live on to further, I guess, our humankind's knowledge of mutations and how viruses can spread and how communicable a pandemic can actually be, or a pandemic virus can actually be, right? And I think that if we protect them long enough with these vaccines, they can then, further modern medicine, so that we won't have to run into this, so that we won't have to run into this within the next 10 years when we're old, right? They have the answers for this already. We have the answers. We've already seen it too, right? And because we've protected them, we now have this, whole new mindset of what to do and how to handle a worldwide pandemic so that it doesn't last 3 years longer than it should have been, right?
Vaccinated women with COVID are more likely to lose fetuses and infants in the womb or shortly after birth. What are the risks of COVID-19 during pregnancy?
We have known for quite some time that it's much safer to vaccinate a pregnant woman than to let her go to term without being vaccinated. And what has happened is, because of the risk of blood clots and other complications that go along with COVID, the fetuses or the potential child in the future are at really big risk for dying. I mean, that study showed that it was several times more common for the fetuses to die in utero, which is...
So it says here from the New York Times, researchers in Scotland reported on this past Thursday, that pregnant women with COVID were not only at greater risk of developing severe disease, but also more likely to lose their fetuses and babies in the womb or shortly after birth compared with other women who gave birth during the pandemic. Who knew? Who knew? That excerpt is from the New York Times also, by the way.
Terribly tragic, and this is something that's totally avoidable. If a woman takes the vaccine, she is vaccinated, and so is her child when they're born. What better gift can you give to your child than to vaccinate your child against a deadly disease? They won't
That's
be able
like
right now. They can't take the vaccine
gifts.
until
You
they're
can give you
not
even a Christmas gift. That's like just a regular gift. Hey, I'm going to protect you for the rest of, I can, for your life, I'm going to protect you. You're going to take this shot. You'll become
and it really psychologically has such an impact on the mother when she loses a child
Not
as well.
necessarily a superhero.
I do want to ask about people who contracted COVID-19 after being vaccinated. Does that infection affect...
with whatever guidelines that YouTube has right now, especially over false information about COVID-19, I want to just say that any kids listening out there, you will not become a superhero if you take this vaccine. But you will be a lot more protected than the average human being, especially that average human being without an immunization. Please get immunized and then go to school. Don't you want to see your friends? Don't you want to hang out again at school and go to lunch and see your teachers and stuff like that? I sure would.
Serve as a booster shot, if you will, for them, or do they still need another dose?
That answer is no.
This is a great question.
With the kid dying.
Yeah, and it really psychologically has such an impact on the mother when she loses a child as well. I do want to ask about people who contracted COVID-19 after being vaccinated. Does that infection effectively serve as a booster shot, if you will, for them, or do they still need another dose?
That answer is no. They've done studies looking at the responses you get from actually getting an infection and when you take the vaccine, and it's orders of magnitude different. So that even if you get infected, if you are already vaccinated, you do need to get that booster. I think that we need to think about this as 3 is the new 2. Being fully vaccinated means that you have 3 shots, 2 of the preliminary ones and the booster, so 3 shots total.
God, hey, listen. You heard it for yourself from this man. 3 is the new 2, right? So just because you are now immunized with 2 shots of Pfizer, Johnson & Johnson, or Moderna, it doesn't matter, right? We have these mutations, right? And they're running rampant right now. They're running rampant and destroying people because they think that 2 is fine, right? You're doing 75% of the work. You need to do that other 25%, right? Or you're doing 2/3 of the work. You need to do that other third. There you go. Math. Good math at that. Get that booster shot. You heard it here, right? Get that booster shot. Clearly, 2 isn't enough. 3 is the new 2.
3 is the new 2. So to be fully vaccinated, you must have those 3 shots as soon as you possibly can to be fully vaccinated.
That's an important point for people. I'm also wondering, could an infection with Omicron provide immunity against any potential new variants that we start seeing?
I think it's too early to say that. There is some degree of immunity that occurs when you have
very important to keep that in mind. if you get infected with Omicron, that does not mean that you're not going to get infected with any new mutations. It's too early to tell. So the best thing that you can do is get that third shot.
And
do
that's
not think that you are immune if you've already been infected, even with COVID-19. Don't think that you're immune. It's not like, I don't know why people think that, you know, just because you've been infected already, you can't get infected again, right? It's just like a computer. If your computer gets a virus, what do? What's the next thing that you do? You get Norton. You get some type of virus removal software that is constantly running and updating on your computer so that it doesn't happen again, right? Well, the same thing goes for your body. Your body is just like a computer. It has your body literally has electricity running through it right now. I don't know how to make it any simpler for anybody who's looking at a gamer's freaking vlog about COVID-19, you know? That's the simplest terms I can make it. Run that antivirus programming software on yourself.
When you get any kind of viral infection,
literally.
But it is nowhere near the immunity that you get from your immune system being turned on.
For people, I'm also wondering, could an infection with Omicron provide immunity against any potential new variants that we start seeing?
I think it's too early to say that. There is some degree of immunity that occurs when you have the infection, and that's just with anything when you get any kind of viral infection. But it is nowhere near the immunity that you get from your immune system being turned on from the vaccine. That's the purpose of the vaccine, is to get your immune system ready, get it revved up so that you get exposed to it, the virus goes away, it says goodbye. Right? That's really what we're trying to do, is to make sure that you're ready to take on the infection when it comes.
You know, we heard so much about herd immunity early in this pandemic. Now, given the community spread of COVID-19 with Omicron, Delta, all these other variants, will we soon reach the 70% mark we've heard we need to end the pandemic? Or are we watching that percentage change?
I'm intrigued to see what he says.
I think that it's going to change. It's not going to be that 70%. It's going to have to be higher because, especially with Omicron being so infectious, it's probably more infectious than the measles. Instead of one person being infected, when you had maybe 7 or 8 being infected when you had Delta, now Omicron is orders of magnitude higher than that. It's way more infectious. So you're going to need to get up to 90% or more. That's just my speculation for us.
Exactly. We've been talking about herd immunity for the past 2 years. If that was the case, and people, because the more and more people who keep spreading this, not necessarily a lie, it's not a lie, there is such thing as herd immunity, right? But the numbers aren't large enough to create that herd immunity. The herd, majority of the herd, is still not vaccinated. So as long as that's gonna keep happening, we can't rely on herd immunity. It's irrelevant at this point and further on until we reach at least like 80% of not only the national average, but maybe even the worldwide average, because what about people coming into our borders? We're gonna have to, it's a whole thing, right? It's a whole thing. Stop thinking about other people. Stop relying on other people. Just do it for yourself. Do it for your kids and do it for your family.
The quote-unquote herd immunity. Herd immunity was that amount where there was so much immunity where people don't get infected, but it's going to be much higher. But it's 62% of people being vaccinated with 2, with 30% being vaccinated with 3, only 35% of children being vaccinated. We are in a bad space right now.
What does it say? 64.6 million confirmed COVID cases. Regardless of what you think about, you know, propaganda or false information, this is, I could care less, right? This is right now the numbers, right? And even if we looked at let's see, COVID cases, what's Google say? So COVID cases, 892,000 in the United States. What about, I wonder about in Maryland. Wait, so this is just in Maryland? There are 892,000 cases in Maryland right now. In Baltimore County, there's 119,000 cases right now confirmed. From our world in data in the New York Times. This is wild. This is wild. And people still want to, you know, rely on herd immunity. People still want to rely on, other people doing it so that they don't have to do it themselves. I mean, I get it. If you are afraid of needles, I get it, bro. I get it. So am I. If anybody is afraid of needles out there, so am I. I'm definitely afraid of needles. I literally had surgery, I think, like 2 months ago, and I could not stop screaming because all they were doing was cutting stitches out of my face. I get it. It hurts. It sucks. But think about it. You get to live after that. Just let that settle in. Over 800, almost 850,000 confirmed deaths. Ridiculous.
We need to really focus, make sure we protect each other, wear that high quality mask you can, make sure you're well ventilated with places you go to, make sure you're assessing your risk, because whenever you travel now, you're at risk, and there were 20 million people traveling.
73.5% of adults are fully vaccinated. This is good, all right? This is in the U.S. alone. Again, I was talking about worldwide at about 80%. 73% in the U.S. If maybe we shut off our borders, I don't know. I'm not a politician, but again, and I'm not saying that just to be like, you know, whatever. But maybe like the United States needs to be in a freaking quarantine, right? We need to quarantine ourselves, right, for however long. I don't know. That's probably not even the best course of action, but 73.5% of adults are fully vaccinated. 86.8% of adults have received at least one dose. That is terrible numbers. I mean, that's good. That we're doing great. We're doing a lot better, I guess. You know, I know some people personally that weren't gonna get vaccinated at all, and now all of a sudden they are getting vaccinated. Just if you ask them, you know, it's like they had a complete change of heart, right? 41% of adults have received a booster dose. That is good. That's good. That means that a percentage, like all those people who are receiving a booster dose also got their second shot. So we're making steps into the right direction, but I think, and I'm not trying to say we need to do it faster, because the more we rush things, the more, you know, things seem to unfold. We need to let this happen naturally. We need to just keep doing what we're doing and spreading the word about how getting immunized is a good thing. It's not a bad thing.
For 2 weeks, a lot of those folks may have gotten infections because of where they went. So it's important for us to make sure that you get that vaccine into arms as soon as possible, and that the value of these tests that we're talking about is going to really help us guide whether or not you're infectious or not in order for you to get back to work.
All very important points. Dr. Andre Campbell, we thank you so much for being with us.
Dr. Andre Campbell was his name. This video was brought to us by CBS News. You can check this out on their YouTube channel. Real quick, I'm going to pause here. I want to tell you about Prime Gaming. If you have Amazon Prime, literally Google Prime Gaming. Click the first link. It'll take you to here, the home page. I don't have a whole bunch of games, but I do know I want more. And here's where they have all of these free games. Look at this, 4, 8, 9 games for free. I've claimed all of them. You don't have to download all of them, but I advise you at least claim all of them so that they're in your library and you can play them whenever you feel like it. For example, they have Jedi Fallen Order, Total War Warhammer, World War Z, Aftermath, In Other Waters. I think I'm going to play In Other Waters next. I just finished Paper Beast. I'll link this, that video playthrough in this video, probably in the top right corner. But yeah, that one was a really good, cool game to play. Very trippy, very aesthetic, very ambient. I loved it. It's like origami animals. Very peaceful, very peaceful. If you need a break from all of your other games that you're regularly playing, play that game. All right, so let's move on. Real quick, I want to talk about I want to talk about 5 natural ways to boost your immune system. Okay. Again, this article is brought to you by express.co.uk. It was also the most trending article on Google about you know, boosting your immune system and what you can do. Without further ado, sorry, my dog was wanted some attention. All right, so it goes through. The following reads: winter can be tough on the immune system, with higher circulating levels of bacteria and viral illness to fend off in the cold weather as the body's natural protection against harmful cells. It is crucial to actively take care of this network of organs, and this is how. We have a video here. I'll play that video after I finish reading this. The immune system is a powerful defense used to reduce the risk of contracting infections. Nourishing this vital network of internal organs is easily done with 60% of our overall health controlled by our lifestyle. While a healthy diet and plenty of sleep, I completely agree. Literally, if you just start eating better and having better sleep patterns, you just based off of that, you'll see a change in your overall health and how you feel, how you're breathing and stuff like that. You'll have to consistently do it, but after a certain amount of time, you'll really start to feel just better from a healthier diet and a bit more sleep. Are proven remedies for good health. There are a number of lesser-known ways to boost the immune system. Express.co.uk spoke to Cheryl Lithgow, matron at Benedin Health, to find out the most effective natural remedies to improve your immunity. And I guess that's going to be in this video up here. We're almost done here. Why is immunity important during the winter? Our immune system is a crucial part of everyday health, but it becomes even more vital during the winter. While everyone is born with the innate immune system, a natural level of immunity, adaptive immunity starts as we grow up and become exposed to a host of new bacteria and other harmful cells. Speaking exclusively to Express.co.uk, Cheryl Lithgow, matron at not-for-profit healthcare provider Benedin Health, said, "During winter, we often have a perfect storm, challenging our immune system. Less access to vitamin D, higher circulating levels of bacterial and viral illnesses, and for some, less focus on their activity and health. Without innate immune protection against COVID-19, the adaptive immune system has to work even harder to identify the body of the virus, which is why it's even more important to build a strong general defense while living with coronavirus." Okay, so let's check out this video real quick before we end here. It's only like a minute long, so.
How to boost your immune system, because your immune system protects you against viruses and bacteria. The interesting thing is 70% of the body's total immune system is actually in your guts, and that's quite remarkable. And what we're talking about here are your friendly bacteria. So what I want to advise you to do is to increase the population of friendly bacteria by eating yogurt.
I knew
Plain Greek yogurt, Greek-style yogurt. And if you look at the label on your yogurt containers, you might see some long names. These are the names of the bacteria that are in there. Lactobacillus is a common one. Now, having increased the population of those friendly bacteria, you then should feed them by increase the population.
So, some healthy 3-point plan to boost your immune system. It says yogurts, beans and bananas, and D3, which is vitamin D. That right there are probably the easiest ways to boost your immune system. Eating yogurt and having a banana or two a day, that's the easiest thing you can do for yourself, just to boost your immune system and stay a little bit healthier, right? And then maybe grabbing some vitamin D tablets from your local pharmacy just to keep you going.
Population of those friendly bacteria, you then should feed them by taking probiotics which are found in foods such as beans, any sort of beans, tinned baked beans, fresh beans, French beans, butter beans, etc.
So, okay, so here's what he's saying. He's saying you need to give your body some healthy bacteria, which is found in probiotics like yogurts, which is found in probiotics, which is easily found in foods like yogurts. And then he's saying that you should feed that bacteria and probiotics with beans and bananas,
etc., and or bananas. They're good, simple, cheap ways of boosting the food to your army of friendly bacteria. And the third point I want to finish with is vitamin D, the sunshine vitamin that's actually made in your skin under the action of sunshine. And of course, the northern hemisphere of the world has actually gone through its winter months. So we're all low on vitamin D, and we should be taking vitamin D.
Yes, completely agreed. So basically, he's saying that
to boost, feed them food, increase the pop.
So basically, this man is saying that if you follow, and these are the 5, I guess, steps to boost your immune system. Not 5, but there are some other steps within that article. These are a few. But again, giving your body some healthy bacteria, which is found in probiotics, which is found in foods like yogurt, like high amounts of it, right? A good amount of it, good high amounts of it. And yogurt is tasty, right? And you should feed that bacteria with foods like beans and bananas to sort of boost your immune system. And then since we're in the winter months right now, literally outside of my window, it is snowing right now. It's snowing. There's no sun for anybody, especially like he was saying in the northern hemisphere, where we're going through that winter solstice. Do yourself a favor and grab yourself some vitamin D tablets, some vitamin D tablets. I don't know if it comes in any other form, but do yourself a favor, grab yourself some of that. It'll help. All right, that's all I got for today. Thanks for watching, and don't forget to let me know if you've been affected by COVID, if you have any personal experiences with COVID-19, and also share the video to a friend, to your family. Tell them to get vaccinated. All right, and if they don't, this is a good reason why you should. Just tell them to look at the beginning. All right, it's been real. Have a good weekend. Deuces.